Hello and welcome to Chapter 10, the second part where we talk about the autonomic nervous system and also a little bit about the conditions of the nervous system. So the autonomic nervous system, as it mentioned, is automatic. So the body is controlling this involuntarily. Now, there's the sympathetic nervous system, which is usually seen as fight and flight, and the parasympathetic nervous system, which is the one that returns it back to normal. So it's usually seen as rest and digest. So when you look at them, a sympathetic is fight or flight. And so if you think what would happen if you are scared, so your heart rate increases, your blood pressure increases, you also sweat. So these are the things of an adrenaline rush. When you look at the parasympathetic nervous system, the parasympathetic nervous system is rest and digest. So it's going to slow the body down. So slow down heartbeat, slow down respiratory rate. And then the blood will be shunted to the gut. So this way, when digestion occurs, there's a good blood supply in order to absorb all those nutrients. Now, when you look at it, there is great detail on diagram 1014. I just want you to get the general idea of what's going on. One will speed up the body, the other will slow down the body. So I want you to get the idea of what's going on without going into too much detail of what exactly is occurring. Okay? So rest and digest, fight and flight. Now, when you actually look at the branches of the sympathetic nervous system, they are a little different. They come off the thoracic and the lumbar. So does it show in this one? Yes. So here is the thoracic and lumbar of the sympathetic nervous system. And then the parasympathetic nervous system is more cervical and sacral. And that's just the location of them. Okay? Good. The neurons of the sympathetic are the brainstem and the spinal cord, and the transmitter is acetylcholine. So here's a nice summary. You don't need to know much more beyond this. We'll go into more detail in your anatomy class. Okay? Good. Now, when we look at some disorders of the nervous system, one thing I want to look at is paralysis. So paralysis is the inability to control your muscle, and that's usually due to a breaking of the spinal cord. So this way the muscles are rigid, over-reflex, and there's communication or lack of communication between the brain and the spinal cord. This can occur from strokes, head injuries, or spinal cord injuries. Okay? Cerebral palsy is a genetic disease, a developmental disease, usually caused in birth, and it is a movement disorder. The symptoms range from loss of motor to greater ability. Good. Cerebral vascular accident or a stroke. A stroke is an impairment of blood supply in the brain, not to be confused with a heart attack. Heart attack is in the heart. Stroke is in the brain. So you can have two reasons why it's impaired. Either you have a clot, so blood's not getting in there, or you have a breakage and blood is flowing is flowing continually due to a brain bleed. The problem is the same in the fact that oxygen isn't getting to the tissue, but the reason for causing it and the treatment is different. Okay? And again, the effect of the stroke will be a result of what area of the brain is it affecting. Good. A traumatic brain injury or a concussion is usually due to the brain hitting the skull and actually bleeding or swelling, and there's an increase in cranial pressure which will then damage the brain and the brain tissue. I have put two videos, or one video on stroke and one video on concussion. Get an idea of not necessarily so much the detail, but what's actually happening to the brain and why this is causing a problem. Okay? Good, and that is the end of chapter 10.